Hey everybody, and welcome back to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and today we're going to go back to January. We're going to time travel back to January and talk through some federal policy to talk about how the Trump administration is shaping the future of healthcare AI governance in particular. So we're going to get started right away. We're going to talk about on January 23rd, of this year, the White House released Executive Order 14179, and shortly after that, the Office of Management and Budget issued a memo called M2521. This has a friendly name, right? Accelerating federal use of artificial intelligence through innovation, governance, and public trust. So I wanted to dive in and kind of decode this, and more importantly, figure out what does it mean for us in healthcare. So here's the deal. The new executive order does three big things. It makes AI innovation a national priority. So it's not just for research. It also means that there's kind of a push to deploy artificial intelligence. Two, it requires every federal agency to have governance structures in place to manage AI risk. And then three, it mandates transparency, especially when AI is used in decisions that affect people's rights, health, or access to services. That means that this now governs the AI that is used in healthcare. And so when I was reading the text of this executive order and paging through the memo, I found myself kind of wondering, how does this compare and contrast with the Biden era executive orders on artificial intelligence? Because if you remember, in the very early days of this podcast, we did a deep dive on the NIST AI Bill of Rights and on some of the federal AI governance that was coming out at the time. That actually happened back in 2023. Time really has no meaning anymore. But in 2023, President Biden issued an executive order on the safe, secure, and trustworthy development and use of artificial intelligence. And I think even the language about how these titles, the language that's used in these titles is so interesting, right? The Biden era executive order is really focused on safety, on security, on trustworthiness, whereas the Trump era executive order is focused on acceleration and innovation. It's really, really fascinating. The Biden era executive orders were focused primarily on building guardrails for foundation models, national security and civil rights protections, making sure that we had space to collaborate with international partners, and making sure that we are red teaming and doing really good safety testing for high-risk AI. So in contrast, President Trump's executive order puts the focus on removing barriers to adoption of artificial intelligence, delegating more authority to federal agencies to approve and scale artificial intelligence, prioritizing American-made AI tools and resources, maintaining the United States' superiority in artificial intelligence is a high priority here, and then treating AI governance as a growth enabler, not a limiter. One of my dear friends used to say that good governance speeds innovation, and this is exactly in line with this executive order. So the Biden executive order was more cautious and was more focused on centralized oversight and a heavy focus on governance. This memo takes a more decentralized approach that really prioritizes innovation. Both of these are aiming for trustworthy artificial intelligence, but they're different in tone and in tactics, right? One of them is very guardrails first. One of them is very go, but with governance. And that has real implications for how healthcare systems interpret risk and their mandate to innovate and who's accountable for it. So I wanted to kind of break this down and look at, okay, if I'm working in healthcare AI governance today, how is this policy going to impact my work? What should I take from this? How should I be incorporating this federal guidance into my work? So whether you're in IT, whether you're in clinical operations, whether you're in compliance, this is really important communication from our government. So the first thing that I was thinking of is that governance of individual models is now really more concrete than it has been. So federal agencies now need to track the origins of data sets. They need to document how models were trained. They need to evaluate risks, and they need to prove that the model can be explained to somebody. So this is a checklist for compliance. In healthcare, this means that we need to be more rigorous about treating our clinical algorithms like we would treat a medical device. There's a long, rich history of medical device regulation and medical device compliance. We can bring some of that rigor into our clinical algorithms. We can track the data lineage. We can test their performance, and we can document, hey, performance of this level says we're going to pause this until we can retrain the model. Performance that deviates from our expectations by this much means that we're actually going to pull the plug. If you don't have a system in place for that yet, now is the time. And I want to note that when we talk about governance, we spend a lot of time talking about pre-deployment governance. We spend a lot of time talking about governance in planning and development and validation. A lot of this is for post-deployment governance. So ongoing monitoring and auditing and thinking about who really owns that accountability and who is responsible for ensuring that your models and your algorithms are performing the way that you think they are. Are those performance characteristics documented? Are they agreed upon by all of your stakeholders? That's really crucial. So second thing that really stuck out to me, once again, we have a mandate to designate a chief AI officer at the federal agency. This is one person, a single person with a role who is overall responsible for AI strategy, risk, and scaling innovation responsibly. So talking again about who in the end is holding people accountable for their model performance, a chief AI officer, this can roll to them. It can also roll up through your compliance. The question is, especially in health systems, who owns that AI governance? If we don't know, maybe now is a great time to clarify. Even if the title isn't Chief AI Officer, it might be your innovation lead, it might be a data science person, it might be somebody in compliance. But the important thing is to have somebody identified who owns that governance, and in particular, post-deployment monitoring and auditing of your AI tools. Number 3, AI strategy is now a deliverable. So agencies are required to publish a strategy outlining where artificial intelligence is used, how it's governed, and how it aligns with their mission goals. This is a great tip for everybody. If you're going to be using artificial intelligence, you should do it on purpose. You should create an AI strategy that maps your use cases, that identifies areas of opportunity, that outlines your risk tiers. We talked a lot about the tiered risk that's coming out of the European Union and the EU AI Act. So in healthcare, what qualifies a particular algorithm as low risk or moderate risk? Can you, once again, define accountability? This is a real theme here. So governance requires a person or a role or an office to be the central authority. We have to make sure that somebody is keeping an eye on the people who are deploying these things to make sure that we're meeting all of our best intentions that we set out when we were doing our early stages of governance. You also want to make sure when you're doing an AI strategy that you include a workforce training plan. Our moral obligation is to be transparent and to produce AI that is explainable. But in order to do that, we also have a mandate to do baseline education for our workforce to make sure that everybody is reasonably educated about what artificial intelligence can do, what it can't do, and what are the principles that govern how it's used inside our organization. It'd be really great if your AI strategy could be spun that it could be shared with your patients. It'd be really great if your AI strategy could be spun so that it could be shared with your partners, maybe partners that you're doing artificial intelligence development with. A document like this can really spur a lot of very helpful conversations, and I would be absolutely delighted to read somebody else's if they were willing to share it with me. I think it could be great. Number 4 thing that stuck out with me is a push for open models and shared AI assets. So the memo pushes agencies to share data sets and models and code both internally and publicly. So this is interesting because healthcare, we get kind of closed off, right? HIPAA gives us a really helpful firewall to say we can't share information unless it's really required, unless it's necessary for treatment, payment, operations. But if we're thinking about a world in which our mandate is also to innovate for artificial intelligence, what sort of structures, what sort of cooperative groups, what sort of nonprofits are going to come in and fill that gap? How can we safely and reliably share our information and innovate together, all of us? Also really interesting, I'm thinking not just about data and about models, but sharing real world stories about here's what happened when we tried to solve problem X. We were looking at no-shows. One of my very early podcast episodes was on a health system that was looking at predictive models for no-shows. And the question really arose, like, what do you do with that information then? Do you double book people? Do you proactively modify your schedule? The context in which you're using an AI tool is often just as interesting as the AI tool itself. And I think those kind of conversations can happen very productively between healthcare organizations without necessarily compromising our patient privacy. Thing number 5. High impact AI is going to get much more scrutiny. So our memos are defining high impact AI as systems that affect health, rights, or access. This makes perfect sense to me. Working in healthcare, I presume that pretty much everything we do is a high risk AI system. So this means in healthcare, Formal risk assessments. Can we get something together? Can we write something down? Can we make a plan to mitigate the risks that we have identified? And then can we make sure that we have documented when are we going to pause a system? When are we going to shut it down? And it can be, hey, we're not going to shut it down unless it is literally hacking robots who are wandering through the hospital, like attacking people. That's okay. We should just document that. That's the important thing, to have had the conversation, made the decision, and written it down. Last thing. Number 6, talent and culture mandates. So workforce development, it cannot be an afterthought here. And we talked about this a little bit when we were talking about the need to educate the workforce, right? Agencies are required to plan for training both technical staff and non-technical leaders in AI literacy. I don't think I would change a single thing about this, right? Health systems need to do the same. We need to know, our legal teams need to know, our quality teams need to know, our boards need to know the fundamentals of how AI works and how it's governed at your organization. So I want to wrap this up and say I'm reluctant to delve into politics, but the federal government is going to be a part of how you use artificial intelligence anyway. If you work in healthcare, the federal government is a big part of your regular business anyway, right? We do a lot of work with patients who have Medicare and Medicaid. So federal policy turns out to be directly impactful on healthcare business, regardless of your thoughts about the state of US politics in general. If you've been listening to the podcast for a while, you know that I care deeply about how we build trust in artificial intelligence. And the thing that I think is interesting about this new guidance is that this is a signal to put a priority on innovation, and to do so while using governance to enable that innovation. So not using governance as brakes, but using governance as a way to say, how do we do this safely? The goal is to enable innovation in a way that earns trust from your clinicians, from your patients, and from like the Joint Commission, right? If you're in a health system that has AI tools live, I think this this executive order is a really good heads up to make sure that you're headed in the right direction with being able to explain and monitor your tools before the compliance tram comes through. So a few quick takeaways, a few action items. If you have an internal AI strategy document, think about who can it be shared with? How can you better communicate your internal AI strategy? If you don't have an internal AI strategy document, write one. It's an amazing exercise. Number 2, know who your governance leads are, who is accountable for ongoing auditing and monitoring, and to whom does that get escalated or reported. And then 3, training is not just for technical teams. Training is for everybody. Artificial intelligence is touching all of our lives now. And if you're going to be using it in your health system, you need to be able to explain it to everybody, from your environmental services workers all the way through your board. So if you are at all interested in any of this, please drop me a line, drop me a comment. I would love to continue this conversation. Thank you so much for listening. Really appreciate you.